Hello, and welcome to another edition of Plant-Based Doctors. Today, we have with us Dr. Robert Call. He's a board-certified medical doctor, allergy and asthma specialist, and former president of the Asthma and Allergy Society of Virginia, president and chairman of the board of Richmond Academy of Medicine in the past as well. And he's also my son's doctor. We took my son, to Dr. Call for his expertise, and I'm so honored that he is joining us today to share his knowledge about allergies and specifically food allergies. Because, here at healthylife.healthyeyes.com, we worry about trying to make sure you're feeding your body exactly what it needs and not putting in toxins that might be harming you or making your medical condition worse. Again, this is all for medical education, no direct medical advice. So let's get started. Welcome, Dr. Call.
Hey, thank you. It's great to be here. I always love talking about food allergy. It's one of my favorite things.
Yeah,
in fact, I have some food allergy myself. I have the alpha-gal, the red meat allergy from the tick bite.
Tell us more about that, because that's something really new, I think, for a lot of people.
Yes, it's really becoming very common. I see cases of it almost every day, certainly every week.
Wow.
And it comes from a bite from the Lone Star tick that is prevalent in the sort of the mid-Atlantic area out towards the Mississippi. So it's a common tick, probably more common since the winters have been milder. And there's a sugar in the saliva of the tick called alpha galactose. And what happens is that gets injected into people when they bite and, when they feed on people. And then some people get allergic to that sugar. Now, what's unfortunate about it is that sugar is also in mammalian meat and meat products. So all mammals have that same sugar. So when you eat it, you ingest it. If you're allergic to it, bad things happen.
So why is it causing an allergy now versus before?
That is such a good question. We really don't know. I mean, it's been out there probably about 15 years, but it seems to be getting more prevalent. I mean, allergies in general are more prevalent, and there are several theories, like the hygiene hypothesis. We're just too clean, and our immune system has nothing to do. So with no infection to fight, it goes down the allergy pathway or the autoimmune pathway. But we're not sure. There's a lot of emphasis now on the diet and what we're eating, in the sense of what our intestinal bacteria are doing and how much variety there is. A Stanford study showed that the Western diet sort of provides only for a monoculture of bacteria, so less diversity of bacteria in our gut, whereas third world countries have much greater variety of bacterial species in their guts. And if you think about it, it's almost like, the United Nations of our body. Like all these, the immune system is there on the inside of our intestines, and all these bacteria are in there. So there's this communication. And there really needs to be that communication, just like in the United Nations, so everybody gets along and nobody attacks anybody. So, it's interesting. There was one study where for an eczema, when if mothers of babies put the binky in their mouth after it hit the ground, they had fewer children with eczema. Whereas if the mothers washed it off in water, then more of those kids would have eczema. So that's another sort of a maturation of the immune system in babies, coming from the mom or dad, that sort of thing, from the mouth, the oral bacteria. So, there's the bacterial theory in the gut. There's the sort of hey, we're just too healthy. Nothing's, attacking us. So we're like, our immune system is like a teenager and it goes off and does bad things. So those are two theories. So yeah, those are probably.
How does it affect you? Like, how did you find out that you had the alpha-gal?
Well, I knew about the alpha-gal problem.
Oh, you knew you had it?
No, not at the time. I remember getting bitten by a tick and going, "Oh, that's not good. That was a Lone Star tick." And then 2 weeks later, I was eating a bacon and cheeseburger. And then it takes like 2 to 6 hours before you react, because the sugar has to be processed in your gut and then go into your lymphatics, we think, and then get into your bloodstream, and then you react. Initially, at 4 hours, I got a stomach ache. Like, I thought, all right, maybe I had some bad beef, and it's just spoiled. But then my hands and feet started itching, and I went, oh no, alpha gal, there goes meat out the window.
So, I
So I
mean,
took,
you're educated and you knew exactly what was going on. How would someone who's not in the medical field kind of figure this out?
one of the keys, I think, for me anyway, when I'm diagnosing people is, you remember it takes 2 to 6 hours for a reaction to occur. So a lot of people, they eat their steak at dinner, their hamburger, and then they wake up in the morning or in the middle of the night with symptoms. That whenever I hear morning hives, morning this, morning that, the first thing I think of is the alpha gal allergy. But it's difficult because I have patients that only have eczema, and that's all the time. So if people eat meat all the time or meat products, they could have symptoms constantly, like stomach aches, itching, a whole host of things, not just the gut and not just hives and anaphylaxis. So it's
It could
hard.
be mild or severe. So what
That's
exactly,
right.
while we're talking about alpha gal, which meat products are the most common to cause that problem, or which cross reactivity, I guess?
You know, all It's all the mammals, but I'd say probably beef more than pork. I have some people who can eat pork and some who can't. I've got one guy who can eat well-cooked meat, but he can't eat rare, steak. But in general, it's all of the mammals: deer, lamb, beef, pork, and some have dairy. A high percentage of people can't tolerate dairy either. And so you have to be on the lookout for, these products, meat products like gelatin in gummy bears and, capsules and dairy products and lots of things. I mean, I was looking up French fries for a patient the other day at McDonald's, and they have beef tallow in the French fries and dairy protein, product. So go figure.
I did not know that. And French fries from like any particular, well, I guess we shouldn't say any restaurant names, but
Well,
French
no, no,
fries, like frozen French fries? What are we talking?
no, it was McDonald's, and it was on their website. Now maybe they've changed it since then, but certainly, it's tough, because foods get mixed together and hidden, and sometimes it's hard to decipher what's in what unless you have that list of ingredients.
So, I mean, that's a great transition to dairy because I think dairy is a huge cause of allergy, not just with alpha gal. Can we talk about dairy and like the common symptoms that you see with dairy allergy?
Yeah, yeah. It can be anything like any allergen, but one of the things I see non-allergically is just mucus production. People almost don't even have to be allergic to milk to get this excess of mucus in their nose, their lungs, their sinuses. But you're right, milk allergy is very, very common because why? Well, allergic people get allergic to what they're exposed to. And, most people drink milk now, although a lot are avoiding it. I drink oat milk just because I don't want to eat a lot of milk because I don't react to it, but long term, I don't want to push the envelope. So dairy, yeah, dairy can cause eczema. It can cause runny nose. It can cause people to have anaphylaxis, hives, asthma, pretty much anything. And one of the more, another new thing now is something called eosinophilic esophagitis, where you get these allergy cells in your esophagus and it starts to swell. And so food starts getting stuck in your esophagus. Things like steak, if you don't chew it up well enough, or pork or something like that, or even bread. And that's new. That sort of parallels the alpha gal story, Tom wise. And dairy can be one of the real common ones for that.
So people just notice like trouble swallowing with that, or?
Yeah, exactly. Yeah, it gets stuck going down, and then maybe it'll go down, and then sometimes it won't go down. They have to go to the ER and get it either plucked out or pushed down.
Wow. Do they have like dry mouth symptoms too?
No, they start salivating profusely because the saliva won't go down the esophagus, and then it kind of comes out your mouth.
Hmm.
So
I think all my kids had dairy allergy as babies, and I think my son had dairy allergy. That's why we brought him to you. But my son, especially when he was like a couple of days old, he turned blue twice from regular like Similac formula. And since my daughter had vomiting when she was a baby with the Similac formula, I switched him to Alimentum, and he did great with that as a baby. Do you think that was really due to dairy allergy, or as a mom, I was really scared when he turned blue twice with regular formula.
yeah, most likely. The confusing thing about dairy would be lactose intolerance, and that would be more diarrhea, gas, bloating, that sort of thing. So sometimes that's difficult to sort out. But if you take lactate supplements before drinking any dairy or eating any dairy, then you'd be okay. That
If you're
because
lactose intolerant, but if you're like
correct.
dairy allergic, then that would not solve the problem.
Exactly. Some allergic people can't drink milk or have ice cream, but they can have um, cheese or yogurt because it's old, it's aged, it breaks down, and the immune system doesn't recognize it. So some people can get away with that, or they can get away with cooked milk, just like egg. Some egg allergy people can take things with eggs cooked in them, like pancakes and muffins and waffles, but
That's
not.
not one I think about very commonly. There are people with egg allergy too, just egg, like no chicken or turkey, just egg
Oh
allergy.
yeah, right. Yeah, a lot. There's a fair egg is one of the common allergens as well as milk.
Oh, I didn't know that. Is it the same kind of symptoms, all allergic hives
Yeah,
and eczema?
yeah, yeah, exactly. And even in eczema, and as I tell people with children who have egg allergy and eczema, I go, right, they don't call it eczema for nothing.
That's a good one. And then lastly, I'm gluten free, and I know you're gluten free. Can we talk about gluten and gluten allergy and the whole range? I know there's celiac, which is the worst, and then just gluten intolerance, and just get
Yeah.
your expertise on that.
Yeah, I think you're right. I think I'd break it down into three categories. Gluten allergy, which you can skin test for, and that can lead to anything such as hives, anaphylaxis, stuffy nose, wheezing, all the common allergy symptoms or gut problems. That's where it's confusing is when you have diarrhea or bloating. So that's allergy. Celiac is a different antibody system. It's actually the sort of the infection fighting antibody system, and that leads to sloughing off of the lining of the intestines, but also even systemic symptoms, which allergy can do as well. But there's a blood test for celiac. The skin test for celiac allergy would be negative. The gluten allergy, whereas the antibody for celiac would be positive. So it's a simple blood test to tell the two, really. Um, and then what? And then there's everybody feels bad. There's gluten intolerance, or hypersensitivity. That's not allergy. It's not celiac. I tell you, pretty much almost everybody feels better off gluten, off grains, because it gives you such a sugar high. The sugar goes way up, and then your insulin takes it way down, so you bonk. So almost everybody who avoids grains has more energy, they lose weight, and what more is there to ask for?
So tell us your story and when you changed your diet and what is your regular diet now?
Yeah. I had tried to, my family is all vegan, gluten free. My wife has done it for many years, and my four daughters have done it. I tried it for a month and failed drastically. And then I got the alpha gal allergy, so I couldn't eat the red meat. And the red meat is kind of like an addiction. I think it's all the fat. And so once I'd been off red meat for a while, for a year and a half, then I saw that Netflix show Game Changer, and it was about veganism and the benefits of it. This martial artist guy had gotten injured, and he was looking for the best, nutritious way to heal. And it looked like the vegan diet improved blood flow. And so I went on that, and I'm really lucky because my wife and kids all cook really good vegan meals. If you had to do it yourself, I think you'd fail. It'd be very difficult if you didn't know how to cook it, because, you know, there is so much variety in a vegan diet, but you want to make sure you get your protein. And it's easier now, though, because there's Beyond Meat, you know, the sausages, the beef, there's the Impossible Burger. So, you know, the options of meat substitutes is so much better now than it used to be. So it's so more doable. Because I typically have a Beyond Meat sausage every morning on, you know, on the way into work. I have some oat milk, and then you know, we do a lot of legumes. But so yeah, so it's been very good. I feel good. I lost 5 pounds that I've been trying to lose for 20 years. So
So
I
you
feel
are,
healthier. I definitely
you're
feel
like
healthy.
mostly vegan now, but you have some.
Yeah, if I go catch some fish at the bay, I'll eat them. Or if I go hunting, you know, birds or something like that, I'll have that. But I've avoided chickens. Just occasionally I have an egg, just because I love egg on toast or fish roe eggs or a
You're
super.
like a 95% vegan.
Yeah, yeah, exactly.
That's kind of like me. I'm like a 99% vegan. Like I won't be super strict about it, but if I want to eat it, you know, once a month or something, that's okay. You know,
Yeah,
but the principles are trying to avoid all the chronic diseases like high blood pressure, heart disease, diabetes, by avoiding all the things that increase your risk, avoiding the animal fat, and then trying to focus on whole foods, or, you know, just vegetables and legumes and lentils and all of those things, which there's so much variety. Once you get into that, you can't run out of things to eat pretty much. And the meat
you
substitute.
really can't. You're right. You really can't. There's so many. And then if you throw in Indian cooking, you know, the turmeric,
Yep.
the coriander, I mean, it's just endless, you know, combinations of beans and vegetables and rice, and that they all taste good together. It's incredible. Avocado, and oh, it is. It's truly amazing. It's nice to have that variety. And it overnights well, right? The leftovers are great.
Oh, I love it. And we try to reserve all the meat substitutes also sparingly, because back to all the studies on processed food versus unprocessed food, you know, a meat substitute is still a processed food, which still
Yeah.
can be high fat. So trying to reduce
Yeah,
that
true.
as much as possible. So where can we find you if someone wants to come seek your advice? Your practice
Yeah,
is in Richmond, Virginia. Tell us more.
yeah, yeah. Richmond allergy and asthma specialist right here in Richmond, Virginia. So, yep. What is it? 804-285-7420.
I'll put
We can
your
even do.
website and links to you on the video as well. And, you know, we're
Okay.
doing this video series just based on, you know, my health and my health challenges and my family, and for education. And my family and I have started a nonprofit, the Pradhan Family Foundation, and it's all about scholarship locally, trying to give to high school students once we have some funding, and as well as educate and community outreach just like this to help educate community and patients about how to listen to their bodies and what might be contributing to their health problems. So I really appreciate your time today. Is there any closing words you want to say or share with our viewers?
Um, I think, you know, food allergy is woefully underdiagnosed. You know, I've seen a lot of gut problems and headache problems with it. And I remember seeing a lady who, and sometimes we have a problem that lasts so long we think it's normal almost. And I had a lady with sinusitis, and I put her on an elimination diet, and she came back 2 weeks later and said, you know, my sinuses are no better, but the 20 years of diarrhea is gone. So probably my point would be, if you're an allergic person, right, hay fever, you know, spring and fall symptoms, and gut symptoms or headaches, that makes you more prone to food allergy. So you know, if you're an allergic person, that makes food allergy more likely, right? Because you're an allergic person. So you can be allergic to both food and environmental stuff. So environmental treatments aren't working and your symptoms are all year round, maybe it's food allergy, because we tend to eat the same stuff all the time. And remember what I said, allergic people get allergic to what they're exposed to, like dust mites, pollen, mold, and the same is true for food. So thank you so much. It's great being with you.
Well,
And
if you have one
yeah,
more
let's
minute,
do it
you
again.
said something really interesting. You said something about headaches, and patients don't realize that headaches can be from food allergy too. Do you have
Yeah,
another minute to just talk about headaches and food allergy?
yeah,
Because
yeah.
headaches plague so many patients.
It is true. You know, certainly sinus headaches, especially, but even some migraine headaches have lots of different triggers. Beyond allergy. Just, I think if you're an allergic person and you have these other symptoms, it certainly is a possibility that allergies could be playing a role. It might be just enough to hit you over that tipping point. And with that, you know, with some allergy treatment, maybe the triggers aren't so bad and you don't get those headaches as commonly or not at all. So yeah, headaches are in that realm of allergy, especially if you have a family history of allergy, like your mom or dad or brothers and sisters. And it just may be subtle, very subtle. So
Thank
yeah,
you so much.
talk to an allergist.
That is so helpful, and everyone needs to, pay attention to what their body is telling them. I really
Amen.
appreciate your time. And
Yeah,
if you,
thank you for having me.
you're welcome. And if everyone likes this video, please like and subscribe to our channel, and we'll catch you next time.